Melissa. My name's Emerald. I'm going to be your nurse today, okay? Is it alright if I check your badge real quick?
Sure.
Alright. Can you tell me your name?
Melissa.
And your date of birth?
7/1984.
Okay. Just want to make sure that we have the right patient. Okay, your doctor has ordered for the insertion of an NG tube for gastric decompression. And what that means is just that we're going to put this tube down in through your nose into your stomach. And what it's going to do is it's going to suction all of the gastric contents out of your stomach. Okay, the reason that we're doing this is you have an ileus, and what that means is that the bowel has stopped working, so that all of your stomach contents is starting to back up in your stomach. That's why you've been throwing up and feeling nauseous, okay? So we're going to put this down and pull all that out and give your bowels a rest for a while so that you can heal, okay? All right. So I'm just going to go through right now and just talk you through the whole procedure before we actually start, explain everything to you, and then once I'm done explaining everything, we'll actually go ahead and do the procedure, okay?
Okay.
All right, the first thing that I'm going to do is put this towel across you so we don't make a mess, don't get anything on your gown, any of the water, any of your stomach contents, okay?
Okay.
All right. And then can you go ahead and blow your nose for me just to make sure that we clear your nose out before we begin? Okay. All right, now the next thing that I'm going to have you do is go like this with one side, go like this with the other. Which side do you feel you can breathe better out of? The right side?
Mm-hmm.
Okay. The reason that we do that is we want to put the tube down the airway that seems the most open to you, okay?
Okay.
All right. So next I would wash my hands, and I'm going to put gloves on for this procedure, okay? You ready? Now we need to measure. We want to make sure that we get this into your stomach, that we don't, just leave it in your esophagus or go too far, get into your small intestines. So the way that we measure the tube is we take the tube from your nose to your ear, and then from your ear to your xiphoid process, okay? And then we're going to mark that spot with a piece of tape. This way I know when I'm feeding it down, I'll know where to stop. And it's an approximate of where your stomach is, okay? After we put the tube down, we're going to get a chest x-ray to make sure that we actually got the tube into your stomach and that it's not in the wrong place. So we're going to check just to be positive that it is where it should be, okay? So after that, I would go ahead and we're going to lubricate the tip so it's easier for it to go in your nose. We don't want this to be rough or traumatic at all to the inside of your nose. We use the lubrication. All right, when I begin inserting the tube, I'm going to have you arch your head back. All right, and I'm going to speed it up, and once it gets to a certain place, I'm going to have you go from having it arched to down like chin to your neck, okay? And at that point, you're going to grab this glass of water and begin to drink the water through the straw. Swallow, swallow, swallow. With each swallow, I'm going to advance the tube a little bit further, okay?
Mm-hmm.
The swallowing just helps feed the tube down into your stomach, all right? It makes it easier for it to get there. So once I hit this place, I'm going to stop there, all right, and know that it's in your stomach. We're going to then secure the tube on your nose. We have a little thing that we can put on that actually holds the tube in place right there so it doesn't move around. Then next we're going to take right about here where this vent is. This is just a vent for air. And we're going to safety pin it up here so that it doesn't become too low. We don't want any of it like leaking down onto the bed or anything else, so we're going to pin it up here on your gown, okay? And then the suction's just going to connect up back here to have it just like that. So your doctor's ordered for it to be on low intermittent suction. And what that means is just that it's a very low suction setting. It's just very slowly pulling stuff out. And the intermittent means it's going to suction and then stop. And then go ahead and suction and then stop. Okay. So we're going to leave this tube in until the doctor orders for it to come out. Hopefully give your bowels a break and give it time to heal and for that illness to resolve, okay? So do you understand everything that we went through today?
Yes.
Okay.
And do you have my gastric contents?
Okay. So I'm going to go ahead and get the rest of the supplies that we need for this, and then we're going to come back and we're going to get started, okay?
Okay.